Hi, I'm going to teach about congestive heart failure today, but before I do that, I'm going to look at a healthy heart very quickly here. In a healthy heart, the blood's going to flow in, it's going to flow out to our lungs, it's going to come back into the heart, and it's going to flow to our body, and everything's going to work very smoothly. But in a heart that has congestive heart failure, it doesn't go that smooth. It doesn't pump through there properly, mainly because the walls of the heart are thickened, and that puts pressure on the heart, it weakens the heart, and it's not going to pump that blood through there properly because of that thickness of the walls. There's two different types of congestive heart failure, and we're going to touch on those in a minute, but the causes of those are from diseases such as diabetes. High blood pressure can cause congestive heart failure. If our valves are not working properly in the heart, then that can cause congestive heart failure because the blood's not flowing properly. But the number one cause is coronary artery disease. Let me explain. The heart has a coronary artery that runs around the perimeter of the heart. And if the blood is not able to flow through that coronary artery properly due to plaque, which plaque is the fatty deposits or fatty buildup within these arteries due to the fatty foods that we eat, then that's going to cause a congestive heart failure. There's two different kinds of congestive heart failure. There's the right-sided congestive heart failure. Instead of the heart properly pumping the blood out into the lungs, instead it's going to back up into the body, and it's going to cause fluid buildup in the body, which is seen by edema in the feet and the legs and the arms. And generally, a lot of times, as it worsens throughout the entire body. There's also left-sided heart failure, and instead of the blood being properly pumped out into the body, instead it's going to back up into the lungs. And so that can cause you to be short of breath and things like that. Is that short of breath increases over time, it can cause a condition called pulmonary edema. And pulmonary edema, as I mentioned, is just that increased fluids in the lungs. That increased fluids in the lungs, it can cause that can be a very serious condition because you're not going to be able to breathe well, and that can be pretty life-threatening. The most common type of, even though there's the right-sided and the left-sided heart failure, is both of them at the same time, which is a double weakness on the heart, and it's not going to pump that blood flow through the heart properly and cause the fluids to build up throughout the body and the lungs. A serious condition is called cor pulmonale. And in cor pulmonale, what happens is the right-sided heart failure, it's due to increased pressure in the pulmonary arteries that pump out the blood to the lungs, and it causes the right ventricle to fail. That's a very serious condition, this cor pulmonale, and it needs to seek immediate medical attention for that. Heart failure is the leading cause of hospitalization among the elderlies. The ones that are greatest risk is those that are 65 years of age or older, African Americans, people that are obese because of the extra pressure on the heart. If you've already had a previous heart attack, then you're more likely to get congestive heart failure, and men are at greater risk than women. Some of the signs and symptoms that I've already mentioned is the increased edema throughout the body, the increased edema throughout the lungs. That edema and that increased workload on the heart can cause fatigue and tiredness within the patient. Like I said, the edema throughout the body is a sign or a symptom, and it grows worse over time. The patient may develop a cough, and that's due to the pulmonary edema, the fluid buildup within the lung. There is no single test used to diagnose congestive heart failure. Basically, it's ruling out other signs and symptoms. There are lots of treatments for it, though. One is a diet change. The patient wants to be on a low-fat, low-salt diet, and the reason for that is you want to reduce the fat so that reduces the plaque within the arteries. You want to reduce the sodium because sodium contains water, and you don't want to retains water, and you don't want to retain any more fluids within the body. You want to reduce the fluid intake. The reason you want to reduce the fluid intake, you already have a lot of fluids on your body to begin with, so you're going to reduce the amount that you're putting in your body. Medications are a big treatment. Things such as diuretics, which is like fluid pills, Lasix, Bumax are a couple of diuretics that are used. Antihypertensives are known as blood pressure pills, such as ACE inhibitors, angiotensins, beta blockers. They all reduce the workload on the heart. Spironolactone, that's one that's blood pressure / a diuretic pill, and it balances out the sodium and the potassium content within our fluids. Isosorbide or Imdur, it reduces the workload on the heart. Digoxin is another one. It increases the heart rate, reduces the blood flow. Another treatment that's used because of the shortness of breath is oxygen, because that helps you to breathe better because of that increased fluid. Some of the things you want to monitor is you want to monitor your daily weight, because if you have increased fluids that's causes weight gain of 3 to 5 pounds over a 2 or 3 day period, then you want to contact your physician, because that's putting that extra pressure on the heart. Shortness of breath, if the shortness of breath increases, then you want to contact your physician. If either of these increase significantly, you want to call 911.